So, what topics covered in Nurse 420 would I say resonated with me really deeply? Well, personally, I would have to say from weeks 1 to 6, the topic of always already listening really caused me to stop and reflect on how this actually appeared in my day to day life and how I would subconsciously practice this in my nursing practice and just day to day life. Looking back, I felt like I used it as a way for me to connect with others and let them know I'm able to empathize with whatever they may be going through because I'm pulling on my personal lived experiences and creating a response that relates to what that person is saying, just to enforce that feeling of connectedness. As well, from week 6, I think a really interesting topic that was a stopping point for me was feminism as a whole and just the feminization of healthcare and the general public's preconceptions on caregiving and how it's a very effeminate practice. For me personally, a lot of people from my culture, I'm Filipino just as a background, choose to follow the nursing profession. But after learning a little bit more about care ethics and how historically the nursing profession has been female dominated and viewed as a very feminine profession, I feel like I am able to take a step back on my preconceptions on this and take a deeper look into how both these topics, both feminism and already always listening, may come up and affect my daily practice or my daily life and my nursing practice as a whole. To create a background for my reflection, I just want to quickly give a preface of the influences from my life that create my ways of knowing. So I grew up in the Philippines and I moved to Canada when I was 3. And although I was at a really young age when I first moved here, I felt that I carried still a lot of Filipino culture and beliefs with me. And by recognizing and looking back on my history as an immigrant, I feel like I'm better equipped to help and navigate handling patient situations wherein immigrant families or patients are struggling to navigate current healthcare systems. As well, my first language growing up was Tagalog, which is one dialect of the Philippines. And when I first started going to school, for me personally, I felt like I was not being understood by anyone. I felt like nobody could understand what I was trying to say because I was speaking Tagalog and not English. And on the other hand, I felt like I couldn't understand what people were saying. I felt like there was a very huge disconnect because of our language barrier. And just by having this experience in my life, I feel like I'm better equipped to navigate and empathize with patients who are struggling because of language barriers and they are having difficulty expressing their needs. Furthermore, I was raised as a Catholic, and even for my high school period, I attended a Catholic school where we had to take mandatory theology classes. But I feel like as I moved on in my life and grew up, I changed a lot of my own personal beliefs and perspectives, and I've begun to gradually move away from a strictly Catholic perspective on life. But by incorporating my understanding of Catholic teachings and using them to supplement my thinking and changing of perspectives, I feel like I can create new ways of knowing the world that are more open-minded and address things more openly and creates a better understanding just of ways of the world works. This is especially important to me because of my homosexual identity. I feel like a lot of the religious teachings, even outside of Catholicism itself, this can be a really rough topic to speak about, and just because a lot of cultures and religions have a lot of hesitations regarding homosexuality. So as I've been growing up, I've actually been trying to learn how to balance my religious understandings with an embracing of my homosexual identity. So because of this, my belief is that these lived experiences and how I've learned to balance everything and all the teachings that I value, it allows me to become a more open-minded person. But I feel like despite this, there is always room for me to grow and reflect on my existing preconceptions of certain things, and there's room for me to learn about different ways of knowing things, such as the feminine perspective of care and always already listening, and that can just help me grow further as a person. Evidently, I've had a lot of personal experiences that influence my ways of thinking and understanding the world. But by looking through an always already listening lens, I feel like I'm better able to visualize how my lived experiences prompt me to engage in always already listening and how it might not always be a good thing. The first stopping point for me that I would say in our classes would have been watching Werner Erhard's video on authenticity. He had mentioned that he would have to stop people and preface what they were saying by saying himself that because of his always already listening, he already knew what that other person was going to say, and then they can engage with the conversation. In my life, I relate to this because I always felt that by pulling on my lived experiences and creating responses according to those lived experiences and according to what that other person is saying, I was creating responses that I thought would help me better connect with the other person and would help them understand that I am empathizing with them and I understand the feelings that they may be feeling because of what they're going through. But looking at it now and having a better understanding of authenticity and always already listening, I am able to recognize that this habit actually tends to impede the creation of more meaningful conversations and therapeutic relationships. As well, now by talking about myself and pulling on my lived experiences, I've taken the spotlight and attention from that patient or that person and placed it onto myself. And now the focus of the conversation is me, as opposed to addressing that other person's concerns or their feelings. I also have seen my already always listening in small and large group discussions in class. The earliest example that I can think about of it coming up would have been when we were discussing our responses to the in-progress writing of what other forms of poverty there are outside of the monetary sense. During that discussion, I had provided my own insights on how current ways of knowing gender and gender roles caused a discrepancy in women to accessing more open job opportunities as opposed to men. My already always listening came up because when my peers would speak after me, they would say something along the lines of to build off of what so-and-so said. But I would not actually be actively listening to what they were saying, and I didn't understand what they were meaning by this. So what would happen is, because of my always already listening, I would take their words of to build off of what you said, and in my mind, subconsciously, I would stop them from continuing their response and create my own response and understanding of what they said and transform that into, no, you're missing the point. Here's what you need to be saying. So what would happen is I'm not actively engaging in what my peers are saying. My preconceptions of feedback are causing me to disengage in active listening and consider my peers' words as feedback on what I'm saying. All they're doing is they are trying to bring down my point, or they're trying to fix what I'm trying to say. But when in reality, all that they're doing by saying to build off what so-and-so said is genuinely just that. All they're doing is they're genuinely trying to add on to my argument and add on what I have to say, but I was not able to recognize this because of my already always listening. Another stopping point for me would be the reading on care ethics and the feminization of care work. As I mentioned before, many men in my culture choose to pursue the nursing profession. So when I first applied to nursing school, as a man, I personally did not feel emasculated nor did I have any preconceptions of care work being viewed from a feminist perspective, or men working in nursing as something that is outside the norm. I only really perceived nursing as a female-dominated field, but I did not care to analyze deeper why that might be the case or what perceptions people would have about me as a man in the nursing profession. The second stopping point for me in this class would have been when we were asked to read Keller and Kitte's analysis of feminist ethics of care, and that's because it allowed me to expand my understanding of feminism as a whole and care work, because of how they specifically outlined how early preconceptions of care ethics were seen to be feminine because of its focuses on emotions, partiality, and how care and justice complement one another. I didn't realize that exercising emotion to guide my decision making and ways of knowing things was a very feminine perspective or way to do things. I felt that because of my personal lived experiences, this is how I chose to approach things anyway, guided by my emotion. But now I'm able to recognize how there are other ways of knowing things, such as through reason and impartiality. Because of this new understanding, I'm able to dive deeper into the complexities of how intimacy, emotion, and caring can help motivate us how to act holistically and influences our nursing practice. By looking back on the small and large group discussions and once again reflecting on the time where we were discussing our responses to the in-progress writing about other forms of poverty, I, at that point, made the connection that backwards beliefs of gender roles equaled women becoming disadvantaged in seeking job opportunities. And this was my perspective of how there was another form of poverty outside of the monetary sense. When I said this, I made the assumption that stay-at-home mothers felt stuck in their positions and did not choose to be there. This was a very per se backwards way of thinking for me, or I was in this way of thinking I was ruled by my impartiality and reasoning, and I did not care to consider the emotions that these women might have and how they may prefer and actually want to stay at home to take care of their children or take care of the home. When I made this statement in class, my way of knowing and understanding things was through a reasoning and impartial perspective, which may have allowed me to make an observation about gender roles and poverty, but also in the end, it may have also contributed to a negative narrative of how stay-at-home mothers are disadvantaged in their position and dissatisfied with the roles that they've been given. The truth is, after learning more about feminism and the feminist care ethics, at this point in time, I did not care to take into account the emotions and beliefs of these women and categorize them into a group based on my own preconceptions, which was just completely backwards. By reflecting on always already listening and care ethics, I feel like I'm growing in my understanding of the overarching course theme of caregiving. I'm brave enough to admit that throughout my nursing school, I did use a task-oriented and biophysical approach to a lot of my patient care, but now that I've been able to reflect on always already listening, feminism, and care ethics, I'm now challenged to transform my preconceptions of caregiving and change them. Within the context of always already listening, my understanding of caregiving has improved because I am more attentive and actively listening to the words and experiences of the people I'm speaking to. And overall, this has allowed me to gain a deeper understanding of the external influences on people's lives. This also allows me to create a care ethics foundation for understanding the emotional vulnerability required to emphasize and truly connect with others that I am caring for. Furthermore, as a male nurse, I'm better able to appreciate and explore female perspectives and experiences in the healthcare system by becoming more present in their care and truly listening to how their lived experiences have affected them. I feel that these reflections and connections most align with the course objective of developing critical thinking and contemplative listening skills for collaboration in an interdisciplinary environment in order to explore EDI and global health issues. I feel that connecting always already listening, care ethics, and my personal lived experiences to caregiving helps me to gain a deeper understanding of how different perspectives on healthcare, such as feminism, sexuality, and gender roles, can better prepare me to tackle and address EDI issues. As I mentioned before, I felt that personally a shortcoming in global health right now is not fully attending to the person or the patient as a whole and addressing all of their holistic needs. Instead of considering the many perspectives of gender roles, sexuality, femininity, or other outside factors that influences a person's way of knowing, I feel that many healthcare professionals are still applying a primarily biophysical perspective and task-oriented focus on their care, when instead, these are very human interactions that we need to be addressing. Because of these human interactions, one teaching I want to bring into my future in practice and just into my day-to-day living is to become more caring by attending to other people's emotions and being more partial in the things that they are experiencing in order to improve my presence and intentionality in care. By doing this, I feel that I am better equipped to put myself in other people's shoes and gain a better understanding of how outside factors might influence their own way of knowing and how these factors might diminish the presence of equity, diversity, and inclusivity in their own lives. One other teaching and kind of stopping point for me was when Werner Erhard said that he began to be authentic about his inauthenticity by reflecting on his own practice of always already listening. He said that to address his inauthenticity, he has to make the decision of either attending to that and following that or challenging that inauthenticity and those practices. So that's something that I want to bring into my future because, as I mentioned before, I feel like from my own personal lived experiences, I perceived myself as a very open-minded person, but now I'm recognizing that a lot of my thinking was very reason-based, very impartial. As well, I always used always already listening to make preconceptions of people and what they're going to say. So in the future, I want to challenge that and be more authentic by just knowing that I have these preconceptions of others and what they're going to say, but throwing that out of the window, emptying my bowl per se, and allowing everything that other person is saying into the bowl and fully absorbing and understanding what that person is trying to convey, what they are trying to say. And I think that could just be really important in my future. One other teaching that I hope to take into my future is applying care ethics in order to transform my own understanding of care work as a practice of feminine values and beliefs, and simply understanding it as just a form of virtuous labor. I can begin to do this by rewriting my understanding of care work as having roots in feminine ideologies and recognizing how the virtue of caring is seen in other professions. For example, Keller and Kitte specifically highlighted police work and firefighting as male-dominated fields, yet these professions fulfill the social imperative to care. In the end, I feel like I'm left with a couple of new questions and wonderings about already always listening and care ethics. To begin with, is there a place and a space for us to use already always listening in a beneficial way? As I mentioned before in my reflection, I felt that it was a tool for me to really help connect and empathize with others. But as people and healthcare providers, what kind of boundaries do we need to make in order to facilitate already always listening in an inclusive and healthy way? In regards to care ethics, why has its values and beliefs always been considered to be more feminine or maternal in nature when actually doing something as small as regarding and recognizing another person's emotions can be done by both men and women? As well, I ask, are the values of care ethics more easily practiced by LGBTQ plus people? For example, are more feminine presenting homosexual men more inclined to naturally adopt a care ethics perspective to their way of knowing things? Or because of their sex, are they still predisposed to being guided by reason in their thinking? in the context of being a student engaging in group discussions, I wonder if my peers engage in their own already always listening when they're listening to my words and creating responses just based off of their own values and beliefs. I also wonder if they feel the same way as I do regarding responses from peers and view it more so as feedback and missing pointers to help improve my argument. Regarding feminist perspectives on care work, I wonder if older generations of patients view my position as a male nurse to be emasculating or feminine in nature. I also wonder if they would be more open to receiving care of this nature if it were coming from a woman, or if they feel vulnerable because I, as a man, am doing the work. I also wonder if older adults' ways of knowing things should be something I am hesitant or afraid of because of discrimination, just because I'm a man in a predominantly women field, or if that's actually not the case and these older generations are actually changing their perspectives of care work being feminine and embracing that both men and women can do it. So in the end, I guess I wonder how people's practices of always already listening, and perspectives on care work and feminism might affect and influence equity, diversity, and inclusivity in my own life. But anyways, that was a really good discussion. Thank you for coming. And I hope I was able to reflect on all my new learnings and understandings on always already listening and care ethics.